So we have a 24-year-old lady. She had an injury at age 4 and never got repaired. But in 2012, she underwent repair, which did not do very well. It became almost like a hypopigmented scar, and you can see the railroad tracks as well, and it catches the eye very easily. So now we have to improve it, and she has some light olive skin. I think she's Latin by background, so that makes it even trickier. For pure like Northern Irish, Caucasians, the skin blends in very nicely. But people who are brown like me, yeah, we don't do very well. And Selena is kind of like me. So what we're gonna do now is we are going to do a multiple Z-plasty and try to get like a zigzag pattern going so the eye cannot notice it as much. It just looks like a zigzag lines. And after that, we are going to do resurface. We try to blend it as much as we can. So it's a very challenging scar, and that's understandable, but we'll give it our best shot. Very good, and we'll keep you posted. We'll show you exactly how it goes. So I'm going to show you the marking step by step. The very first thing I did was to mark the boundary of the hypertrophic scar. And you can see the mild railroad ones, they're not obvious. They're not that prominent, so I left them alone. No reason to make a bigger scar. The temptation might be like, oh, let's get them all in the lips. Please don't. Just only the hypertrophic scar, because we don't have a lot of skin to work with. We don't want to distort the eyebrows or anything, so only this. Then I have, you notice in the center, I've marked the half point. Next, I'm going to measure and mark 2 Z-plasties, and I'll show you that after I'm done. So the double Z's have been marked. The total length was 20 millimeters, so I divided into half, 10 millimeters, made the limbs, and you want to make the limbs where you know that when you can, when finally the lines meet, it's going to be horizontal. So that's going to be horizontal, horizontal, and that's going to be perfect. So let's get to work. Okay, so we are 4 days post-op, as you can see, and it's healing pretty good. And I did a double Z-plasty, and I'm going to clean the incision, take out the sutures, and then apply Dermabond on it, and that's going to give the extra strength. And then maybe within, I would say like 2 weeks, 3 weeks, I'll start the resurface, depending on how it looks after the suture removal. So we'll keep you posted.